Good morning. I'm Dr. Angie Becerra, and on today's Home How-To from Taproot Chiropractic, I'm going to show you how to do a home sinus release. Now, when the allergens start to kick up, like they're just starting now with cedar, we get lots and lots of requests for sinus adjustments in the office. This is another tool that you can have at home to help drain your sinuses on your own. If you do suspect that you have something serious going on with your sinuses or an actual sinus infection, please see your medical doctor to rule out a serious medical condition or pathology. Now, this can also be used on babies. You can use it on your kids as long as you keep your pressure very gentle. First things first, though, let's go over a little bit of anatomy. First, we're going to talk about some of the facial structures here. So there's a few areas we're going to look at. If you can look closely, you can see little holes right here, right there, and right there. Now, those are foramen in the skull. Those are going to be our contact points for our sinus release. The reason for that is because we have nerves that run through there and lymph nodes that run right on top. In this picture, I know the eyes are a little unnerving, but you can see where the nerves run in and around the foramen right here, and same things where the nerves run in and around the foramen right here. Now, when you receive a sinus adjustment in the office, we contact these two foramen directly, but these ones up here, because of their proximity to the eye, we usually come more into this area. So if you're pressing on these and they're a little too uncomfortable for you, you can go ahead and move up about a ½ inch and you should be able to achieve the same result. This picture right here shows the lymph nodes. So you can see there's not a lot of lymph drainage up here, but there is through the inside of the face and down through the neck. So when I show you how to do the sinus release in a minute, a lot of this is going to be moving fluid into the lymph nodes and then moving it down around here. So I went ahead and pulled up a picture with both the nerves and the lymph nodes here so you can see how they run through the skull. Now, when we do this for sinus release, which we're going to do in a second, we're going to start with these two contacts around the nose first, and then we're going to do the contacts on top. If we need to move up a little bit higher, we can. So what we're going to do is we're going to start by taking our fingertips, and we're going to go to those foramen right here, and you can usually feel them. Not with your fingertips, but they usually have just a little bit of tenderness when you touch them. So you're going to hold or tap them for 10 to 30 seconds, and then you're going to swipe down those lymph nodes. So stimulate the nerve first, then swipe through the lymph nodes. So hold here, and then you're going to swipe, and you can do one side at a time if you want to. You don't have to do both together. You're going to swipe out to those lymph nodes, and then down the cheeks a little bit just so you can move some of that flow into the neck. Same thing up here. You're going to take your fingertips and you're going to find those little notches. They're right there. And you can usually feel them because they're a little tender. If they're very tender, like I said, you can move up a ½ inch and go there instead. But you're going to hold or tap for 10 to 30 seconds. And then same thing, you're going to swipe up and down into the face again. Up and down into the face. Now once we've done that part, we need to move into the neck. So here, I like to do both at the same time, but you're going to swipe down the neck right here, and you'll feel this muscle. It's called the SCM. You're going to swipe down that muscle a couple times, and then circle right here in this triangle right by the clavicle. So on both sides, it's going to be down like this, down, and then circle. So a full sinus release, 10 to 30 seconds. Swipe, 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 10 to 30 seconds, swipe, 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 down into the neck, and then a couple circles here. So it only takes a few seconds. Really good to do at home, good for you and your kids. Make sure the pressure is not too much. You definitely don't want to hurt anything. And lymph is pretty superficial. It doesn't take a whole lot of pressure to move it. So you don't have to press hard. It can be very gentle. I hope this helped you and your loved ones at home. If you have any questions about it, do talk to your doctor the next time you're in the office. Have a great day.